Everyone.
This meeting is being recorded.
Thanks for doing that, Carrie. Just let the last couple of people in here. Good morning, everyone. If you already haven't seen, everyone else is introducing themselves in the chat. So if you would like to do that and what health council or department you represent, that would be absolutely wonderful. So as the email invitation stated, this is a little bit of a different session than we usually host on our last Fridays. So previously, these sessions have been called the CDC refresher training, and we're more so focused on aspects of the CDC Kellogg grant and deliverables and how we can be supportive through these processes for you. But over time, obviously, we learned that capacity building has just been such a crucial and critical need for health councils. And with Anne here, of course, this session has been sort of transforming over the past year. And so we decided that we were just going to rebrand this training on the last Fridays of the month, hosted by us at the Alliance for Health Councils, into what we're going to call the capacity building training or capacity building series. And so in order to support you best, we wanted to kick this all off with hosting a listening session and then a facilitated open discussion with health councils about your capacity building needs, and discuss your specifications as well in the governance survey, and how we can use all this information to figure out trainings and tools and support groups that we think can suit you best. And so for today's agenda, just a quick introduction, which is this, and Anne here in a minute. And then we're going to go over some key findings from the governance survey. And then with the governance survey, sort of interpreting the challenges that you have stated, and discussing the needs that are based off of those challenges. And then we want to host a group discussion amongst health councils and Department of Health partners on how trainings led by us at the Alliance can help support these needs and help in overcoming these challenges. And then we'll do a quick summary of our discussion and wrap up at the end.
And awesome. So yes, you're doing a land acknowledgement.
Yes,
are you doing our land acknowledgement this morning? That's wonderful.
I can do that. And so before we really get things started off, I just want to read our land acknowledgement very quickly. And then I can hand it over to Anne. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. Thank you. And sorry that my...
if you want to stop that, I can pull mine up if that would be useful.
Sure. I actually have it here as well, if that's helpful for you. And
oh, that's great for you to do that. So I wanted to say hello to you all, and piggybacking on the land acknowledgement, one of the most wonderful things that the Alliance has been able to do in the last couple of years is there are a growing number of tribal health councils, and Geraldine is with us. And I think, like me, Geraldine may not be in full voice today, so I hope I don't cough too much. But Geraldine's going to be joining us in chat, and be able to continue to grow the power and the impact of our tribal health councils. And we have how many county health councils? Now, there's a growing number of county health councils. And so I want to thank all of you all for coming and being here. And if we'll go ahead to the next slide, I'm going to give a very short presentation. And so we've already covered, the objectives are really to take away sort of the key themes from the governance survey. What I'm going to do with Kiana is provide you sort of a 50,000, 30,000 foot look at the main themes, and then there'll be more detailed information shared. And thank you all for participating in that survey. It provided some incredible information. So as we look at the next slide, what we'll see is the governance survey. When we're sharing information about the governance survey, we're really putting all that information into the capacity building framework. And over the last 2 years, we've talked about the 8 domains a number of times, and I just want to come back to it as a quick refresher, but equity is really sort of the ground. And then the community engagement and partnerships. The engagement piece is so critical to everything we do. And the organizational development one right up here in the middle, that is huge, because if we build our capacity there, we can really do all these other things in these other blocks. If we build our organizational capacity, communications and marketing, we can build in that area. We can do more work with resources and funding. And then if there's strong organizational development that's happening, we can do planning, not only the health planning that's the CHA and the CHIP and all the work with DOH, because DOH is really the lead in that. But then there's the work you're going to be doing with your own capacity building planning. And I love what Kiana said about that's really increasingly important. And then you may in your strategic planning include capacity building, but as part of your broad planning, whether it's called strategic planning or something else, really looking at your own health council and what are our priority goals, and then how do we get there? And then your goals are going to include not only your health goals. For many health councils, behavioral health is a priority. Early childhood could be, housing. And so what are your health goals that you're working on with the CHA and the CHIP? But those aren't your only goals. And sometimes it's a little confusing because you've got those health goals, but then you've got your capacity building goals, because with capacity building, that gives you, capacity building is kind of like the engine for your car or the wheels. That really helps you make things happen. And you're going to have capacity building goals that are going to often include many of these things, but some of these areas in this capacity building framework, you'll see that some of them are really huge for health councils and others a little less so. So we've got the goals and priorities, and that includes your health goals and other goals, and then your outcomes and impact. And that's something, some health councils have done a lot of work in this. Others are really looking to build it. And it's often the kind of thing that developmentally, it takes years to really begin to show that. So I wanted to go over that real quick. And then as we look at our next slide, what did you all say in the governance survey? Well, just a quick summary. You mentioned goals. That's the orange one right here. So there were 2 people that said, yep, goals is way up there. What do you think was the top one? Organizational development. When you look at the feedback, people were saying we need and want more resources, more supports, more technical assistance in helping us to build our health council. And so that's a priority. And we've done some work, and we're going to be rolling out some material to help you look at, all right, what do we do with meetings? How do we get people to meetings? How many of you, and I'd love to just see maybe, Yana, you could track this. If you put an emoji up there or one of the reactions, how many of you are finding challenges engaging people in coming to regular meetings? Zoom is wonderful, and it's also challenging. And then there are so many other parts of organizational development. How do you build your steering committee or the guiding group? How do you work with the policies? How do you continue to grow the health council? Because one of the things we've seen with organizational development with both NMAHC and health councils is you've been doing 5 years worth of work in the last 2 years. I mean, it has been an incredible ramping up of your work. And so building those systems that you need to support that growth. So organizational development is huge. Community engagement. And in some of our earlier work, we used the term stakeholder engagement, but we've discovered that that's really not a term that is as equitable and inclusive as we would like, and we never want to use language that could be off-putting, and so we're modified that. So you're going to see the term community engagement, and in the long form, we're talking about community engagement and partnerships, because the UNM CBPR model that some of you have been taking those courses really looks at community engagement. Funding is also important. So when we look at what's most important to health councils, what you've told us is organizational development, community engagement, and funding. And then with the next slide, we go a little deeper into it, and then my part will be done. So as we look at the next slide, which is, here we go. This is hard to read, and you're going to be able to get all of this in additional material. So in July, we did all of this work with you all, and you completed a survey. We sent you out a report. And so what you said back a year ago was that community engagement was a huge priority, organizational development was, equity was. And so as we look at all of this, and then we look again at some of what Kiana has reported from ongoing contacts with health councils, our community engagement is huge, so is organizational development. Are you all seeing a theme here? Here's the governance survey. Community engagement is huge. Organizational development is really huge. So that's what we found. There's more data, but we didn't want to do like a super heavy data dump. So as we look at the next slide, what we want to do is facilitate a discussion with you. If we could just pull away the PowerPoint so that we can see each other. We would just love to hear your comments about these findings and what's most important for your health council, so that we hear from you about what resonates, with that. Is organizational development a real major issue for you? And engagement and funding. And then also over the last 2 years, people have talked a lot about needing to build capacity around communications and marketing. It didn't come up as strongly in the governance survey, but it did come up in some of the comments. So please share your feedback. And Wendy, I want to thank you for taking notes. Wendy does such amazing work in terms of summarizing, and we want to hear what you have to say. We have a great, large group today. So how does this strike you? Jay.
Hi, good morning, everybody. Well, here in Catron County, our community engagement has been a great struggle. We have built a lot of capacity here recently. Actually, our membership has kind of blown up substantially. And we've gotten a lot of interaction with our northern communities. However, getting our sheriffs, reserve EMS, and some other key community members that we would like to hear from has been an uphill battle. And most of that's just because of personal relationships that have been a struggle, and past history that they've had with the Health Council.
Ah, interesting. I thought you were going somewhere else with personal relationships. And one of the things that certainly many health councils have found is, when we reach out to people one-on-one and we develop relationships, that carries us so far. And what you shared is important, because I've heard other health councils talk about, if there is history and some personal relationships in the past that were tough, that stuff has to be addressed. And so thank you for sharing that. Other health councils. And as we get things in chat, Kiana, can you share those?
I definitely can. I don't see anything at the moment, though.
Yeah, hey, good morning. This is Anna from the McKinley Community Health Alliance.
Oh, Anna, it is so good to see you.
Well, I didn't brush my hair, so I'm off camera, but just kidding. With McKinley, you know, I think we've really, with Chris's leadership, Christopher Hudson, you know, we have struggles with attendance from some of our members, but you know, we can't force people to read the documents, or it's just been, you know, we understand too, as people slowly coming back from COVID experience, it's been slow. But I think I did mention this to Christopher, that it for us it would be helpful whenever we go before the city council or the county commission, if we had leadership from the Alliance of Health Councils to kind of leverage the presentation, that we know what we're doing, because we don't get a lot of support or interest from our elected officials. But I just wanted to put that out there. And of course, we need more resources. We need, yeah, I'll just stop there. Thank you.
Well,
It's
Anna,
good to see
thanks.
you,
And
Anne.
it's
I love your
wonderful to see you.
presentation.
And I know Anna's also the co-chair of NMPHA, the New Mexico Public Health Association, correct?
Yes, they call
Yeah,
it president,
so
co-president.
watch for information about the upcoming annual meeting for that. Really, really interesting. I think maybe we probably need to share more often about the fact that it's a slow comeback. You know, people are exhausted. COVID has taken a bigger toll on us in ways that we're just now beginning to understand. And so I appreciate your mentioning that, because I think we all need to just really check our expectations. And then that suggestion about having sort of the backing of NMAHC with some local leaders from time to time, that could be a strategy that could help a lot. Engagement, I mean, we've never gone through anything in my life. I'm almost 73, and I've never gone through anything in my life like COVID and the economic impacts related to it. Okie doke. So Shay says he loves your idea, Anna. So we'll carry that forward. Other comments from health councils? I'd love to hear from as many of you as unmute and, you know, either raise your hand or unmute and start talking.
Good morning, Ann. This is Ken Reed.
Hey.
You know, one of our challenges here is, and of course, not only here, but you know, I'm kind of affiliated with other tribes too. But what I have seen is, you know, during COVID, actually, COVID had a significant change in a lot of our communities, how we work, how we live, how we go to school for the kiddos, or how we don't go to school, and everything virtual, and all of the precautionary measures, all of the prevention stuff, that's face mask and social gatherings, and you know, it's a lot of that is new, but you know, we just have to incorporate a new way of living. But how does that translate into post-COVID conditions now? Well, you know, I think now that the state is opening up, the federal government is I think Congress is passing legislation and declaring COVID over. But in, you know, at least that's what I have seen in the news here the past couple of days. But meanwhile, in all honesty, COVID is not gone. It's still here. It's you know, we're still losing people because of COVID, you know, and not only that, there's some other viruses that are hitting our communities, and so it's causing our tribes. I'm sure Michelle Lohan Grisham with the state of New Mexico has her public health orders, but in all honesty, that doesn't have any weight on our reservations. Our tribal health, our tribes have their own public health orders, and we have ours, and we're still precautionary measures, and social distancing is still an issue, but a lot of people are afraid, to come together in meetings. Everybody's still walking around with face masks. Nobody wants to go into anybody's offices. They stand there by the door instead. They don't want to enter. And having virtual meetings is great, but everybody, we're back to working in silos. And it's hard to break that barrier. To try to be able to come together and it poses a greater challenge for us to gather data. Even if we have to try to complete surveys, and it's an incredible challenge. And I think somebody mentioned that another challenge and need is resources. The health councils, we get very little money, and people don't want to work part-time. If they want to work, and they want to work full-time, so we're not getting any applicants for part-time jobs, and as a result, our health committee members have to wear that hat, the staffing hat. I have to wear that hat for my health committee, because my program director is social services and tribal courts, chief of police with law enforcement. They're too busy too. They have their own jobs, but in order to keep it going, I have to do the staffing for our health.
Yeah, you have to.
But anyway, thank you. I know I can go on and on and on.
Well,
so sorry.
I wanted to capture two things that seem really, really important. And Ken is a new board member of NMAHC, so thank you for your multiple kinds of service. You've articulated some really important things about the landscape that I think is true, not only for tribal health councils, but for all of our communities. Is that COVID's not really fully over. And what I think we may want to carry forward from what you've said is that we're not re-engaging in the same way. And we need to try to live with that, understand it, and give space for that, because it's not the same. And then the other thing that you mentioned, which we may want to talk about in this as we talk about funding, and that's why I jumped in, is that we've got a real huge challenge with healthcare workforce already, and challenge with school workforce, and recruitment and retention. And health councils are not fully funded. And I think you nailed something that this group may want to talk about is, there's only so much that can be done with $60,000 a year. It's not full funding for a full-time person. It's when we first did the work on this, we were looking at 0.75, so roughly 3/4. And it could be less. It depends on what your salary scales are. So you just nailed something that's part of this bigger picture, which is it's hard to get people that are going to work part-time. And then the other piece is looking at the funding horizon. So Chris, welcome, and go for it. Oh, you're muted.
Yeah, I do that more and more these days. I'm really here to kind of listen to the health councils, but one or two things occurred to me while we were just speaking now is it would be even helpful if the Alliance, in terms of providing some resources or from other people, such as the health promotion specialists, small things that might be useful. So for example, we recently held with the Health Equity Council, we got some of their staff together, and I think Anna Horner's on this call, I'm not sure, but we got some of their staff together with a group of community health workers who are working in the community. And what we did, and this was virtual, it was a fairly large group, but we facilitated that discussion. And one of the things that might be helpful is I've sat on so many of these meetings, and I think when we think we're facilitating, a lot of times we're doing an awful lot of the talking. And what we did with this one was just kind of keep asking questions and keep moving things along. So any of that might help. As Kenneth said, when we're feeling like the virtual way of meeting with people, we might find other ways to do it, but we might also find some better ways of facilitating that communication so that people who are participating can feel that they really are more involved and can have more say. So there's little things like that. The other one is, and again, I'm thinking back to the fact that we're still kind of doing virtual. Torrance County, and this is where I think a small amount of funding, if that can be helpful to people. Torrance County has a small disc that's called an owl. And when you use it, it helps you, it helps the both in-person and virtual meetings so that you can almost see everybody. And when one facilitates, they can do it much easier. And my understanding is it probably is more than that with other technical equipment, but it's something like $800 to $1,000, which isn't that much to get, but it has been incredibly useful in having these kinds of virtual and in-person types of meetings.
Yep.
And if other health councils could utilize small things like this,
Yep.
it'd be very useful. So
I love that. And actually, when Chris does communication work as alongside Sarah Bowman, real great resource for communications. And if you're interested in the owl, contact Debbie Ortiz in Torrance County. Now, I would like to ask you all a question, and that is, I want to get some more engagement from you all. And so if you could take the next 2 to 3 minutes and write in chat, what is your top number one capacity building priority and why? And I'm gonna look at the chat. I can't wait to see what you're putting in there. And Wendy, thanks for all you're doing. Your
And
number one
I did add something to the chat. The Alliance has purchased 2 OWL systems. We tested them at our annual meeting, and I'm maybe speaking for Val here too soon, but I'm pretty sure those are available to loan out to health council so you can try them out.
Oh, that's awesome. Okay. And for some reason,
the only thing with that, Ann, just real quickly, is the Alliance does need to provide a little bit of technical assistance in using it, because like Adrian at Torrance County has gotten to the point where he can just put the things right out on the table, connect everything up and do it.
Yes, Chris, thank you. We also learned while doing. So we also, I think, have acquired quite a bit of technical confidence. Mostly Rebecca has become quite adept at this.
Yeah, yeah, that's great. So my chat, unfortunately, I'm out east of Santa Fe right now, and I've got some iffy internet, so I can't see the chat. But I'd love, Kiana, can you help facilitate this with me? And I'd love to hear what people are saying about their top priorities, and then hear more from the group about what you really want to see support for, and why.
Well, I'll just kick in. Shay said his Tatron County's top priority is getting members from elected officials and the sheriffs. Remember, he mentioned that earlier, because they're on the ground seeing daily issues that we might not see. And Anna concurs, I think. She wants more local participation.
More local. Okay, great. And so, Kiana, what are you seeing? If we could help me out with Kiana and Wendy.
That's it for chat so far.
Okay. If you all could take just another minute or two and put what's most important for your health council.
So San Ildefonso says a similar local and community participation.
Each of the health councils could just take a minute or two and jot down what's really important. Oh, we've got some good stuff coming in now.
So Mary says providing transportation for our residents to and from the city for their needs. Lori Collins, we want members who are active and excited to grow. Margaret, funding and continuous partner engagement. Shelley says more community participation. We know new people means new ideas. That is a really good point. Ooh, there's a lot. Okay. Sarah, simply getting members to show up to the meetings and being engaged during the meetings. There's a big trend here in all these. Let's see, working on getting elected officials to participate in health councils, not just attending once a year, but having their field office representatives, staffer, or themselves be in attendance each month. At this time, we have 2 county commissioners on board, but we need and want more community leaders. Okay, so Jessica says, critical capacity building area for board of directors only is recruitment of board directors and training and support about the legal and financial responsibilities of the board. So both engagement and organizational development. Anna says needs access to internships. Iris, more support from leadership and local participation. Sarah, again, would also be helpful to dig into how to more effectively manage local politics and how to make them work for you. This almost goes a little bit in line with what Shay was speaking about earlier. And Barbara says adding also less represented areas, a county commissioner, and board training.
Oh, this is great stuff. Keep adding things, and I wanted to see if we could talk a little bit about, we've got a good number of health councils represented. So share with me, if you don't mind, just unmuting. Let's everybody unmute and share with me what are some things that you've tried with getting people engaged in membership and people coming to meetings. That let's start with what hasn't worked. What have you tried that's just not getting traction?
The virtual meeting has been very difficult, mainly because of the internet access. And sometimes when we're having a meeting, it cuts out. Then things are voted on and you're not included. It's just been very difficult. So I like the OWL idea, but we are trying to get more people to come and move the meetings around.
Okay. Thank you very much. Other folks, challenges.
Well, and to kind of go along with what Barbara said, before I started as coordinator, we had tried to move the meetings around and to different places in the county to include the lesser included cities. And it failed the last time. We are trying again. And I think actually since the involvement has increased in those areas, we actually hopefully it'll work this time. And our internet connections, yeah, it's just been real shoddy. Our last meeting actually virtually, I used my mobile hotspot and it actually solved the internet issue. So I guess from here on out, I'm just going to use my mobile hotspot because the actual Wi-Fi that's provided is just not very good.
We've got a lot of broadband issues, don't we?
Yeah, I
how
think
many
that's
of you
statewide.
Yeah, it's statewide. So if we're in rural communities, we've got I got a broadband issue this morning.
But,
So that's an
again,
issue. What else
but
are you
again,
doing that's been a challenge?
if there are tiny solutions like that that may be helpful, they may not work in all, but to provide health councils with hotspots or something like that, those that have those kinds of issues. I'm just looking for small pieces that might help in the long run with some of these issues.
Yep, good point, Chris. Other things that you've tried that maybe have had not so good success, or you're not sure yet?
Sarah Bowman here from Eddy County. I would say the status quo of doing email blasts to send out information about like what we're doing as a health council tends to kind of get ignored. We use Constant Contact to do our email blast. So I'm able to dig in and look at our open rates and our, participation rates on the emails. And I'm seeing a significant drop since the beginning of the year. We're not getting as many people opening up the email blast, but we are getting a lot more engagement with social media. So it seems that people are kind of changing where they're participating from.
Wow. We want to find out more about that, because what we're looking at doing as part of this work is we're going to be coming back, sharing information about some building blocks of what the strategies are around the organizational development issues and building blocks, and some easy wins. So part of our framework has been for some time, we want to be able to share on an ongoing basis some things that different health councils share that work, because together the health councils can really share things that work. And that's what I want to move to next is, what are you doing? Like Sarah mentioned, Constant Contact, it's giving you great information. And then it's also telling you, and I think we're finding that you get email fatigue. And so what you're sharing about social media is great. The other thing that I've heard from multiple health councils is we got to get on the phone. We got to go to some meeting or another. I went to something in Santa Fe that was just a wonderful gathering last night, just to be able to visit with people. Margaret, what you doing in Hidalgo? Margaret? Margaret had her hand up. So
Yes,
Kiana?
I'm sorry. I finally unmuted. Okay, so one thing that I'm doing in Hidalgo County is just as much as I ask my health council members, please participate. I am participating in their organization as well. We have DWI going into the schools. I constantly call them monthly. What day are you going to be in the schools? I like to be there to help you. Put me to work. Tell me how I can help you. I receive every information that they're giving these students, and I bring it home so I can firsthand talk to these parents if they're questioning. Well, I know DWI is in the schools, but I don't know what they're doing. Oh, I do, and I fill them in. I let them know exactly, because that's what you want to do. You want to be firsthand knowing what your health council members are doing within their own organizations. You want to care for them just as much as you want them to care for you. So that is my main thing. I am there for them. I will scratch their back double over if they scratch my back once. That's how I see things. That's how I make relationships. If I don't see them in a couple of months and they have not come to the health council meeting, I try to make like a lunch date. Hey, let's go to lunch. How are you doing? Instead of saying, where have you been? I'm asking, it's all about how have you been doing? It's kind of a reminder. Don't forget about us. Don't forget about coming to the meeting. And I don't bring anything up like where have you been? And it always happens. They show up to the next meeting after that. So yes, I guess I'm old school. I like to be personal. I like to be in front of people, hands-on, face-to-face, on the phone, speaking with my health council.
I love it. So I love it when we start talking about solutions and what works, because we heard from Sarah. That's terrific. Chris talked about trying to get the little wins. What you've just shared, mean, isn't that the heart and soul of what health councils are about? You build relationships. You have relationships with other people in the community. You go to other events, you support those, and they come to the health council because the health council is the big tent. And when I love what you shared about, somebody hadn't showed up for a while, you pick up the phone and give them a call. Doesn't that make all the difference in the world? I'd love to hear from some of you who haven't shared yet. Tell me about, is that kind of outreach helping you? Are you able to pick up the phone and maybe there are a couple of health councils that have created little membership groups. And so have you been able to reach out and call people or drop in, support their events, or go visit them, really create those relationships? I'd love to hear more of what you're doing.
Well, just yesterday, we had struggled for a long time with our relationship with grassroots behavioral health in our county. I recently got them back on board. They're attending our meetings and everything. And actually they're in crisis right now. But I attended their main meeting yesterday. I'm actually a member on their board now. And to offer that help and to just be there for support has really been working wonders. And it's been a great relationship building.
Oh, that's awesome. So Hidalgo County, contact Margaret for stuff. I can't see who was just talking. So share again who you are and your health council.
Oh, this was Shay Yantis with Catron County.
Okay, so Shay and Catron. So those are two examples. Who else is reaching out on a one-on-one or, just really connecting? And what's it doing for you?
Sarah Bowman here, and we're in the same exact boat. Just this last Friday, I stopped by our fiscal agent's office, United Way of Eddy County, and I brought them some cupcakes, and we sat down in their conference room, and we spent a good 2 hours just catching up on everything that they've got going on, everything that we've got going on, everything we're hearing on the street. And then I asked them, what can I do for you? Do you have any needs that you've heard about in the community that you're not able to fulfill that we as a health council maybe could fulfill? And they let us know that the schools are running short on antibacterial wipes and hand sanitizer, and there's not enough funds at the school district level to be able to accommodate that. And they asked if the health council would be able to help fill that need. And so now we have something we can focus in on and hopefully get more members from ultimately. Out of that. But again, it goes back to the, if I can scratch your back, you can scratch mine thing. And they did ask me to be on their board as well, this most recent visit. So that was kind of like a acknowledgement of, oh, okay, cool, I'm doing a good job. And they said I can stop by whenever I want. And now they also have offered their boardroom to us to be able to use for our meetings. So everything works out, and building those relationships, I think, is really key. And if you can kind of figure out what their mission statement is and really use that in your conversations with them, I think that really pays off as well, because it shows that you're doing more than just the surface level. You're really digging into what their mission is and that you care about their mission.
Oh, I love that. Diana, good. Just put a heart up there. That's really where so much of the work gets done. And we start to work together, we build relationships, we understand not only what each other's agencies are doing, but we come to really support one another and care for each other. I'd love to see if there are another 1 or 2 comments for other health councils that may have not shared yet. And then I want to hand it over to Yana to wrap us up and talk about next steps. So if there's one last comment, I'd like to ask for that. And if not, I want to toss it to you. Kiana has done such an amazing, she and Geraldine are my go-to folks that I work with at the Alliance. And it's such an incredible team with them and with Wendy and with Aaron and with Rebecca and with I'm sorry, I've got anyway, uh, we've got a team and there's also a great NMDOH team. You have sorry, you have a great NMDOH team. So Kiana, can you take it? I'm going to lose my voice. I'm so sorry.
This is Anthony. Can you hear me?
Yeah, we can, Anthony. Go ahead.
Yeah, I was waiting for Iris to say something. I see her, she's on the line, but she must be busy. So, of course, San Domingo, I'm listening to everything that is being said, but I just wanted to kind of hit what most of us are thinking about these days is that what happened to the state legislature in terms of our funding as health councils is kind of not devastating, but yet at the same time, kind of tells you where the public is in terms of health and maybe healthcare in the state. But as far as us as health councils, you know, we had organizational development as one of ours, and you explained it quite well earlier. If you don't have the basics of an organization, then you can't do all these other things that you are describing in most of the call. For example, even a finance office or even HR policies or even the management of any place that you are working requires support. And sometimes the health councils don't get that. Yes, you are finding some resolutions and recommendations on how to go about that. But once you get outside of that circle, then there are other work groups that you have to contend with. And just for example, there was a roundtable with the DOH director a couple of days ago. And it's interesting to note that there's a lot of other things that are still not being coordinated. And looking at it in terms of the different departments, HSD, DOH, and all these other committees and work groups that are being established not only nationwide, statewide, but also all of this equity mantra that is going on. There's social inequity, racial inequity, health inequity. And so those kinds of discussions, sometimes you wonder, where are we actually going with all of this talk? But one of the things I think is that we still need to be persistent and maybe still have the mouthpieces out there to keep reminding them of the importance of the health council, because that's community based, that's county based, that's tribally based at the community level. And that's what I keep saying to everybody all the time. The challenges that we have in terms of recruitment or maybe even the politics internally, those are very difficult to overcome sometimes, but we keep at it. And it's really some of the local beliefs and attitudes and maybe even historical way of doing business really kind of figures into our organizational development attempts. But with all of this being said, the other thing I wanted to point out is that it seems like every meeting that I go to, it's the same people, the same faces, the same uh, uh, individuals championing some of our work. And I guess we really need to recruit outsiders or outside of the healthcare people to help us with that. For example, our own little health council at Santo Domingo, I've been voicing to get a male on there or middle-aged men who seem to not care about their health. But let's get them in here so that we can hear their perspective and work with that age group or that demographic. There are some others, older citizens that are always concerned about health, but yet at the same time, the younger people really need to get involved with these kinds of things. So there's always challenges in how to do that. And I would like for that girl that made the cupcakes to come and visit our health council. I like cupcakes. But that is just a simple way of really getting to some of the audiences that we need to get to. And I think that the discussion here still needs to be continuing. And we really need to make sure that at our local level, we get the support. And that is very difficult to do because of just what I had mentioned. But I do respect all of you that are still working on this, because that's the only way we will have to just continue working with our state legislature, because it seems like they spent more legislation on how to take public health authority away from the government versus the private and the big pharma and big insurance wanted to make sure that, and even big government wanted to make sure that the public health issues are not controlled by the state, but by private enterprise. That's my political speech there. Thank you.
Thank you so much, Anthony. Oh my gosh, you said so many things that I think resonate with everybody here. And I think one of the most critical and why we're here today too is what you said, that if you don't have the basics in an organization and you don't have any foundation, you cannot do any of this work. We cannot, you know, in the state with the Department of Health or with us, go through all of these CHIP processes with health councils and then expect them to implement them, you know, without the foundation necessary to do so. And so, you know, I think that's one of the key reasons why this meeting is going on and why we feel like this needs to be continuously supported. And so to that, I'll do a quick summary of what we went over today and next steps. You know, because of everything that Anthony said, we have realized this at the Alliance as well. And I said in the beginning, some of you may not have been here yet, that we are rebranding what was formerly known as the CDC refresher training, which more so focused on technical assistance and support for the deliverables, but now is being rebranded to what we're calling capacity building trainings or capacity building series. And we also discussed the governance survey and as a group here too, just some of the top challenge areas and which are community engagement, organizational development, and funding and goals, and then also improving government relationships. But one of the key parts about community engagement that I noticed in the governance survey and in the discussion today too is the just sort of the spectrum and process that is community engagement. And so a lot of health councils today mentioned different parts of community engagement. And so whether it's the type of engagement or the part in community engagement was really an important thing mentioned here today, which just really solidifies the need for the peer learning groups, which we've talked about, and I'll talk about here more in a minute. But with community engagement, you know, as Anne said, for those who missed it, we are talking about stakeholder engagement, but we have changed the term because the stakeholder engagement does have some harmful history. So in community engagement and partnerships, health councils mentioned the types like health council membership engagement, board engagement and participation, engagement of partnerships, and engagement in government relationships, and then engaging with the public themselves and the people that we all serve. And then in this process, there's also how do we identify all of these key partners? Who do we want to engage? And when we do identify them, how do we recruit them into the cause? And then how do we maintain engagement as well? And oh, Chris, you have your hand up.
No, just a quick addition to what you're saying, and I fully support everything you're saying. I think it's great. I think one of the key questions we need to ask ourselves, because you are using the term community engagement a lot, and we are doing that, is it struck me when we were talking about the ways that one of the questions I think we need to ask ourselves more is how do we engage the communities? Because a lot of what was talked about here is the most positive are people in the health councils actually reaching out to other people, asking them those kinds of pieces, because again, I think the question becomes, why do they want to join us? And some of that might be, you know, the purpose of the health council in terms of what we're doing for them. But the other one may just be, you know, how they're treated when they come to a health council meeting. Do they get to have a say? Is their say as equal as everybody else on the committee and everything else? So I think part of it is, and I think those people who are reaching out now and saying to groups too, what can we do for you? I think that's kind of how we need to think about community engagement a little bit more.
Absolutely. I think that is a really, really great point. And, you know, in this discussion today, I feel like all of us have just had such valuable pieces to offer into each place that an aspect that we discussed today, which is why we have learned that peer learning is really, really, really critical. But we need to have a space, I think, for each aspect of capacity building. And so in this discussion and in our plan moving forward and how we can best support health councils is, you know, using these discussions, how do these challenges mentioned equate to actual needs? And then how can we best support at the Alliance, best support health councils to meet these needs? And so, as I said, we have learned that peer learning is really, really, really critical. And so one of our next steps as the Alliance is to create peer learning groups. And so we are hoping to deploy groups that will be focused on community engagement, on communications, and then by governance structure. So like by tribes, tribal governance structure, nonprofit, or county ran. So we hope that we'll have a little bit more to share on this by the next month's Friday training on what this will look like and how people can sign up. It's still a little bit in planning mode right now, but based on everybody's feedback and sort of affirmed today, we feel like this is the best route. I think the key findings from the governance survey is that each health council really have individual needs. And so we will focus and continue these Friday trainings that's hosted like right now on the commonalities between every health council's challenges. And because, you know, there are some, and as evidenced by today, and then allow the peer learning groups to expand on these topics together that makes support more individualized for you. And I don't know, Anne, if you have any more to say about the peer learning groups, but that's our next step. And, you know, trying to make listening sessions actionable, you know, is really, really important because, you know, a lot of this is sort of repetitive too from what you mentioned in the governance survey. So I know it could be a little bit frustrating for you, you know, that we're still in the listening session. And so our next point here obviously is to move this into something more actionable. And we would love it to be completely led by health councils and need your input every step of the way. Anne, do you want to keep going?
No.
All right. So Wendy took notes today, and so our next step for you all is that we'll send out a summary of today's notes. And as we are structuring the peer learning groups, we'll keep you all posted along the way. And you can feel free to reach out to any of us if you have any comments. And we're really excited to share how that's going to look for all of you in the future. Any last comments, Anne?
Thank you all so much.
Wonderful. All right. Thank you all so much for coming today. I'm going to download this chat actually because so many wonderful things and valuable things were said in here. So we look forward to sharing this with you all. Thank you again.
The Alliance staff, if you want to hang on the line a little bit, I have a question for each of you, or both, all of you. That was a large group today. Kudos. So Chris Hollis and I worked on a training roadmap menu buffet kind of document. And we struggled with just first of all, the taxonomy of it all and how to lay it out and what would make sense for folks. And then we also thought, oh my gosh, if we actually put this out there, it's going to be so overwhelming as people won't even want to start, because what you don't know, it can scare you if you realize what you don't know. And I don't mean to be hold back information. That is not the point. But I think that document could be helpful in kind of either thinking of things to train on or co-learn or peer support on. But I'm happy to share it because you and I haven't looked at that document in a while, but I think it's still relevant and could be useful. And I think I sent it to Anne at one point, and I don't know where it went or if it was useful, but we could certainly resend it and let the Alliance pick it apart and do whatever. I mean, it was actually a map of like a high, middle, low skill thing. It was a who offers this training and where can you get it and who would be willing. But I don't know that it's a great public resource, but I'm certainly, I have no ownership over it. I don't care how it's used. But I will send it. And then my other question is Val okay? I haven't had any responses from emails in a while and I'm just concerned. I know the legislative session was for everybody, but.
And just to be honest, Diana's not the only one who hasn't gotten responses. So
I think that Val is on the call right now.
Oh, hi.
She is 4889.
Oh, good. Okay, wonderful. And I understand if you needed to take time after the session. I was just making sure that you were okay, Val. So, what a relief. Okay. So
thank you. Can you all hear me?
Yes, Val, we can.
Yeah, thank you so much. I too am dealing with internet connection, so I'm working out of a very noisy cafe at this time. And indeed, legislative session, all the way through essentially the end of March, has been very busy. I also had a loss in my family, so I did take a couple of days off. So I'm moving as fast as I can. I so appreciate the concern and look forward to staying in touch with you as we move forward. Thank you for the patience and understanding.
Of course. Well, I feel better. I'm so glad you're here today. So I will send the document to as many of the Alliance staff as I can remember to copy on that email, and I'll include you too, Chris, of course.
Great, Diana. Let me tell you, it's so timely because we are putting together a capacity building library, which would be an online searchable library. And we would love to take a look at your document because it sounds like a lot of those resources we need to incorporate somehow into our library. We would love to work with SDOH, with your health promotion staff, in putting that library together. As it turns out, we do have a couple librarians that we have access to. Sharon Finarelli, for one, was the librarian in previous life, and Braza have volunteered to help. So if you could please first send that to us, but secondly, if you have any bandwidth and interest in helping us structure that library so it's super user friendly, please let me know. I'd love to have your help.
Okay.
Secondly, we have sort of a related document that Geraldine is taking the lead on, and that is our equity library. So resources specifically to help people do equity. So, right, Geraldine, either one of those libraries, we would definitely ask for help on that. Welcome your involvement.
Thank you for the time. I know that I asked for a little bit extra over this meeting, but I appreciate it. And I will get this out.
We appreciate your gifts to us.
Yeah, absolutely. Deborah, do you want this document too?
And I don't know who else.
I'd love to have it. Thank you.
Okay, Deborah.
Wasn't able to catch that.
Deborah said yes, she would love to have that.
Okay. And so Kiana, I'm trying to not forget people.
You know what? If you send it to any of us, we'll make sure everyone gets it. So just send it.
I should be able to get most of it. Kiana, how do you spell Kiana? I don't have your email in here, Kiana.
It's Kiana at, all of us are first name at NMAHC.org.
How do you spell your name, Kiana?
It's
Kiana.
K.
Also,
Oh, I
just
do have it.
Diana, I know that we also got your training modules. So I think if there's another way we could also look at that and incorporate this in part of the capacity series, I think that would also be great as well.
Absolutely. And quite frankly, I mean, there's nothing to stop you from pulling them down.
Okay.
Well, we have to find them first though. So if you could,
There, yeah,
directly to where they
yeah,
are.
I had instructions for how to present it, but that might be a non-issue. So
We need a little technical support from you.
I have the links, Wendy, so I'll share them again.
Okay, thank you.
So they're up and running on their website now.
Oh, great. Okay.
and they work more or less. Yeah.
Excellent. Thank you.
Thank you all. Thank you for
Thank
the time.
you.
Bye-bye.
Bye.
Bye.